Let's take a look at some common uses of radioactive materials and what their biological effects are. Probably the most well-known use of radioactive material is for X-ray machines, but in fact they generate X-rays, but they do not use radioactive materials. So they generate radiation in the form of X-rays rather than gamma rays, but they don't use radioactive materials in this. Most common place to find these would be in a doctor's office, in a dentist's office. As with gamma radiation, X-rays can be blocked by layers of lead or concrete. So when you're being X-rayed, if it's just your mouth in the dentist chair, they'll probably drape a lead apron over you. In the doctor's office, the radiation technician will go behind a concrete wall so that they are protected. Another way that radioactive materials are used, and sometimes it's radioactive materials and sometimes it's radiation generated similarly to the way that X-rays are generated, is sterilizing food. Much more common in Europe than in the United States. And food is treated with gamma radiation while it passes along a conveyor belt. Then this food, once it's treated, is sealed in an airtight package. The radiation, the gamma radiation, kills the bacteria, kills the fungi. If it's sealed against the environment, there is no more opportunity for these two items to enter the food. There's no leftover radiation. It's kind of like shining a flashlight on something. When you turn the light off, it's gone. When you stop producing the gamma radiation and treating the food with it, it doesn't linger. The food can be stored at room temperature, which is a huge advantage. You decrease the cost of refrigeration because you don't need to have things frozen or cold. They can just be stored on the shelf. So rather than frozen dinners in Europe, you can buy the equivalent of frozen dinners, but they've been radiated and vacuum sealed, and you just buy them right out on the shelf. It takes a little getting used to, but they don't really taste any different. Milk is real commonly treated this way as well, so you can buy milk in sealed containers similar to the milk cartons that we get for individual sizes. You can get pint and quart size cardboard type cartons. They're sealed and you buy them out on the shelf. Again, it's much more common in Europe than in the United States. The radiation does produce something called URP, which are unique radiolytic products, and it changes some of the chemicals in the food a little bit, but these have not been shown to alter the taste in food or to cause any damaging or bad effects. It's just a little bit of tweaking that is generally not noticeable. Not clear if they have any effects on people. Europe's been doing this for years and has not documented any harm that has been produced because of them. We've talked a little bit about how radioactive materials are used as biological tracers. They tend to be used in plant studies. Hydrogen, phosphorus, and sulfur tend to be the isotopes of choice, mainly because these are three elements that you find in amino acids. Also, they tend to have short half-lives that agree with the lifespan of plants being studied. They're used to study the nutrient flow, used to study plant growth, and how the nutrients move through the plants. In humans, a whole variety of isotopes are used, and they're used for a variety of different things. So here's a list of them and some of the things that they are used for. So they tend to be used in studying growth, many times in terms of looking at the tissue growth for abnormal developments in the tissue. All these tracers have short half-lives. Usually it's a matter of hours or a day or two, rather than many days to years. Radioactive materials are also used in medicine, primarily for treating cancer, in addition to doing them as tracers in biological scans. Cobalt-60 is the primary source for radiation if a linear accelerator is used. Linear accelerators are what are used as external radiation beams to treat cancer tumors, or they can be used to treat total body cancers such as lymphoma or leukemia. A wide variety of isotopes are used as implants as well. So a small piece of the radioactive isotope is surgically implanted in the tumor, and the type of radiation that it releases bombards and essentially kills the tumor cells without damaging the healthy tissue surrounding it. An advantage of this is it can be inserted and it treats the person 24 hours a day, rather than requiring that the individual come in and be at a specific place at a specific time for treatment. Usually implants are in for a week or so and removed, and the patient's given a week or two to recover, and then as needed there may be a new implant. So here's a list of various radioactive isotopes, their half-lives, and what they tend to be used for. Radioactive material is also used in smoke detectors. Smoke detectors use americium-241. Americium is an alpha emitter, so we're emitting large charged particles, and as they travel through the air, they ionize it. So we have this charged column of air between the alpha source and a detector. So essentially what we're doing is completing a circuit. Smoke or steam will block this flow of ions, and what that does is it causes the circuit that's disrupted to be switched off, and the current inside the smoke detector then goes to an alternative circuit. That's the one that causes the alarm to sound. We've already talked about archaeology and the isotopes that tend to be used there. Carbon-14 for organic remains, potassium-40 for geologic dating.